Good afternoon, ladies and gentlemen. I'm Professor Kim Min-gon of Gwangju Institute of Science and Technology. I'm going to chair the session 2. It's quite disappointing to deliver our presentations and communicate with you online due to the worsening COVID-19 and prevention and control. Then from now on, we'd like to start the session 2. This session will cover diagnosis and prevention with 6 experts at home and abroad. So let me briefly introduce the first speaker. The first speaker is from BODITECH Med. Senior researcher Dr. Jae-ho will deliver the first presentation. He graduated from Seoul National University, and at Rutgers University he earned a doctoral degree. And at Samsung Medical Center, he served as a responsible member, and now he is working at BODITECH Med as a team manager. And he's going to cover the current status of COVID-19 diagnostics solution. Then let's meet him. Good afternoon. I'm Jae-ho from BODITECH Med. Thank you for giving me this opportunity to deliver my presentation. I'd like to talk about the current status of COVID-19 diagnostic solution, in particular point of care. As you know, the COVID-19 pandemic has swept the world. The coronavirus has symptoms like 4 common cold virus. Other than them, there are SARS-CoV, MERS-CoV, and SARS-CoV-2, which is COVID-19 virus. SARS-CoV-2, unlike MERS and SARS, has severe symptoms and is transmitted rapidly. Common coronavirus is like the common cold, and the fatality rate is very low. Generally, you can recover from infection of it. However, during the SARS outbreak in 2012, about 8,000 people were infected and the fatality rate was 10%. When it comes to MERS, the first case was reported in 2012 and the MERS outbreak happened in 2015. At the time, 2,500 people were infected and the fatality rate was 34%. Currently, more than 2 million people are infected with the COVID-19, and depending on age groups, fatality rates vary. Once you get infected, symptoms will express within 4 to 5 days, and within 7 days, you may be hospitalized. And within 8 to 9 days, respiratory syndrome will be expressed. About 20% to 30% of those infected have severe symptoms and get treated in the ICU. The symptoms of coronavirus are similar to those of influenza or the common cold, but according to recent research, the virus affects coagulation, cardiac system, nerve system, and kidney as well. With this multiple organ damage, immune reactions like Kawasaki may occur. To prevent these kind of symptoms, a number of vaccines are now being developed. And to treat the virus, many treatments are now under development. But so far, there have been no treatments and vaccines for the COVID-19. And to stop the further spread, diagnosis and isolation are the best way. In January 2020, when the coronavirus started to spread, WHO announced a virus diagnosis guideline using molecular diagnosis and immune diagnosis. Molecular diagnosis includes PCR and RT-PCR. These are used for confirmation, and when it comes to immune diagnosis, antibody diagnosis could be used to monitor the coronavirus. But immune diagnosis is used for patient monitoring or checking patients' history of exposure to the virus. And rather than the virus diagnosis itself. And a WHO umbrella organization called FIND says that PCR ELISA or rapid test could be used for 9 use cases, and these are 9 use cases. This is released by IQVIA. This is April 2020 data. As you can see, the x-axis shows the number of tests and the y-axis shows the number of fatality rate. It shows the more the test cases, the lower the fatality rates. We had some issues in March in Korea as well, but since April, we have conducted a number of tests, thus being able to control the virus. So Korea has very lower fatality rates and has been reported as a best diagnosis practice country. Once the virus enters in the body, it replicates in the body, which contributes to IgM expression in 7 days, and after IgM expression, IgG will be expressed, which suppresses the coronavirus. Therefore, the number of the virus decreases. And PCR can be used for a test even before symptoms are expressed. Antibody tests can be conducted after symptoms are expressed or in 7 days of expression. Also, immunoantigen tests could be carried out within 7 days of symptom expression. According to recent data, unlike other viral infection, coronavirus, as you can see, IgG and IgM express almost at the same time. And also, the window period for PCR diagnosis of corona is different from that of other viruses. So if you look at this modified virus and IgM reaction, you can identify that IgM and IgG express almost simultaneously or without any difference. Once antibodies are expressed, then antigen or the number of a virus decreases, and you can conduct PCR test until the 15th day. But after 15 days, PCR test positive rates dramatically drop, and then antibody test positive rates go up. According to a paper published in May 2020 in China, for the first 5 days, PCR's positive rates are 90%. It means that sensitivity is 90%, and antibody test sensitivity is 75%. But the number of virus decreases after 14 days, so PCR test sensitivity is less than 50, while antibody test sensitivity is more than 90%. With just PCR tests, we do not have enough capacity to monitor all coronaviruses. If we combine PCR and antibody tests, the most ideal diagnosis would be available. So based on this, we, BODITECH Med, checked possible sensitivity of combination of PCR, antigen, and antibody tests. So as you can see, PCR or antigen immune tests, after immune reaction happens, the number of virus decreases. And since immune reactions test antibodies, the sensitivity increases after antibodies increase. If we combine these two, we would be able to maintain the sensitivity at 10% at all time, thus being able to provide the most optimal diagnosis. We compared a variety of methods. RT-PCR or antigen tests test viruses, proteins, or RNA, but other antibody tests test IgG or IgM created in the body. When it comes to samples for antibodies, we use nasopharyngeal or oropharyngeal swab. Since we use these swabs to test the virus itself, so the sample itself is very risky. In contrast, antibody tests use blood samples. Therefore, infection by blood is less frequent compared to the virus. And RT-PCR or FT-PCR usually take 1 to 6 hours from processing to test. And usually it takes a day for a test, but in contrast, rapid tests can be conducted in a short period of time, so you can diagnose on site quickly. And when it comes to sensitivity, RT-PCR has much higher sensitivity, but sensitivity would change as time goes by. So the sensitivity of antibody test goes up 14 days after infection.
네,
Thank you very much, Dr. Lee Jae-ho, for your presentation. He talked about BODITECH med's technologies, including immunodiagnosis, in particular antibodies generation technologies. If you do immunodiagnosis, then in the future, I believe diagnosing antigen will be available